This video is for nursing school students. I have a nursing school student who DM'd me a while back and said that she needed help with fluid and electrolyte tests, and she used my video in past. She asked now if I have anything on like metabolism and nutrition, essentially in fundamentals, and I didn't have a YouTube video or a printout necessarily to give her, so I figured I'd make this video really quickly with some definitions and things that I think you will need to know for a nursing school exam on metabolism and nutrition. So let's go over definitions because that's kind of the best way to start to memorize things in nursing school until it actually makes sense in your working and seeing the pathophysiology in your students. So let's go over the definition of what is metabolism and what is nutrition. Metabolism describes the entire process of biochemical reactions in the body's cells that produce energy, repair the cells, and just maintain life in general. Know your hormones. When a hormone production increases or decreases, you're going to have alterations in the body. For example, diabetes, obesity, osteoporosis, that kinds of things. Now, when you have alterations in your metabolism, how does it essentially manifest in the body? Acid-base imbalances, for example, in ABGs or arterial blood gases, perfusion, circulatory system, oxygenation in your respiratory system, and then stress and coping, where your adrenal glands release all those cortisol hormones, and then what that does in your body. Definition of nutrition: the sum of all the interactions between the human and the food that the human consumes. Know the steps of the GI system and how we digest, absorb, the organ functions of all of the organs, including liver and pancreas, gallbladder, and then how we prevent illness. What does food provide? Energy, vitamins, calories. What is the most important nutrient? Correct, water. I can read your mind. And then what are the other essential nutrients? Carbs, proteins, and fats, or lipids, depending on how the terminology is in your school. What is the source of energy? What provides the source of energy that are important for synthesis of body tissues and growth of those tissues and maintenance and repair? Protein, very good. What are the two populations that are most at risk for malnutrition or nutrition issues and metabolism issues? Little infants and geriatrics, the elderly. Good job. I do want you to know how to read a nutrition label. That may be on your exam. Vegetarian diets are usually deficient in which vitamin? B12, A+. What is the best way to absorb B12? Intramuscular injections. Know how to do a assessment, health, nutrition screening regarding your history, calculating BMI, physical examinations, lab values of your CBC and your BMP. All the basic metabolic panels. Dysphagia, what is that definition? Difficulty swallowing, silent aspiration versus aspiration pneumonia. The causes of dysphagia, it could be simple aging, stroke, cerebral palsy, ALS, head and neck trauma or cancers, surgical restrictions, things like that. And then who do we contact? Speech pathologist. Let's see, what else do I have in my notes that you definitely need to know? BMI levels, I think I already said that. Enteral nutrition, parenteral nutrition. That includes IV therapy, includes like a PEG tube, includes TPN through a central line, things like that. What do we think about when we think of central lines? Prevention, sepsis, every single time. And then know your diets: clear liquid, full liquid, puree, mechanical soft, that sort of thing. And then it may also help to know what is high protein, high fiber, high vitamins, that kind of thing. And then you should be good to go for nutrition and metabolism in nursing school.